Hello and welcome to Behind the Smile. In today's episode, we're talking about case acceptance and how through better communication with patients, the right tools can make a real difference in helping them move forward with treatment. Today's guest is Dr. Homam Albaghdadi. He is a complex care dentist at Sinai Health System and an adjunct professor at the University of Toronto, Faculty of Dentistry. He is a health systems investigator with the Institute for Education Research at the UHN, the University Health Network, and a certified health executive with the Canadian College of Health Leaders, and he goes by Dr. Alba. Dr. Alba is the co-founder and chief clinical officer of Smilepass, an AI-powered dental technology company focused on transforming how dental clinics manage treatment, presentation, patient engagement, and payment experiences. At Smilepass, he helps lead the development of AI-driven tools that simplify revenue cycle processes, enhance cost transparency, and unlock case acceptance for practices, ultimately making dental care more accessible for patients and more efficient for providers. With a blend of dental industry insight and innovative tech leadership, Dr. Albaghdadi is passionate about elevating the patient experience and supporting dental teams with smarter systems. Welcome to today's episode.
Thank you. Thank you for that intro.
From your perspective, in practice growth and dental ops, how would you define case acceptance?
It's interesting because I think case acceptance is somewhat of a unique nomenclature to dentistry. If you look in the literature, in the medical literature, for example, you wouldn't really find case acceptance. So that said, I think case acceptance is somewhat of a reductionist way of looking at how the treatment planning process progresses and how patients make decisions. In a nutshell, case acceptance is like a patient moving forward with treatment or not. And I really think that it is somewhat problematic to view it in such a binary way. Because the process of treatment planning is somewhat more complex and nuanced, and this is why typically my preference is to look at concepts like patient activation and shared decision making, which are readily researched and investigated. That said, it tells us that we need to do more to define what case acceptance is in dentistry. Sure. I think case acceptance would be useful to look at in the context of, say, comparative analytics, in a sense. If you have a practice where you're providing different kinds of treatments, maybe understanding what your strengths are, like how you're doing in those different categories of treatments, for example.
For sure.
Because it is quite difficult to calculate. If you think about it, you're putting together a treatment plan and patients move forward, but they move forward at a different pace. Sometimes they reject it. Sometimes they opt for an alternate treatment. So how do you factor all of those things into what case acceptance is? It's not easy to define. I think that's kind of
That's absolutely fair. I think there's many factors that go into that. What would you say the biggest communication barrier you see with case acceptance that make patients hesitant to potentially adopt or accept any type of treatment?
We can start with the obvious ones. Socioeconomics, like, drive treatment decisions. We see that day in, day out. Patients' insurance coverage.
Absolutely.
If I have the coverage, I will move forward. What is that coverage like? So that's very much a factor. But I really think that the biggest barrier is actually establishment of trust, maybe. So I think in many cases, and even some of what our research has shown, that when patients have that established trust with the dentist, and by extension the office, they're more likely to move forward with treatment, to figure out a way, if, let's say, cost is an issue,
Hmm.
um, especially if the practice is set up in a way to support the patient in moving forward, providing them with options. I think that establishment of trust is key for the patient to move forward. But obviously, health literacy, so how
Yeah.
much the patient understands about their treatment, the value of that treatment, the consequences of not moving forward with that
Hmm.
treatment. Yeah, I think those are kind of the two biggest things is like
Okay.
literacy and then, the cost issues that typically patients endure. Then you can add logistics and, how to plan for, say a complex treatment or a bigger treatment
For
where
sure.
staging is very important. So I think those are some of the elements that I think about. Yeah.
For sure. I think trust for sure is definitely a really big, important one. And just to touch on that for a second, how do you work within your teams to ensure that you, as the dentist, will be providing the trust with the patient for the treatment? However, you need to instill that same level of trust with your administrative team when they're speaking with the patient at the front. So, how do you bridge that gap?
Yeah, I mean, I think dentistry, like many other industries, suffer from poor onboarding of staff. So I think staff training is really important. Ensuring that the office as a whole is on the same page, so they're
Hmm.
kind of operating at the same frequency. They use similar language. They believe in the philosophy of the practice. I think
Okay.
those elements are quite important. Evidently, nowadays technology can support that process of providing a structure, so to speak, for staff
Yep.
to be able to communicate well, stay
Hmm.
on top of things, and that consistency, I think, breeds trust with the patient. And that should really manifest throughout the patient journey from the step where they're with the dentist all
Yep.
the way through to, when they're checking out essentially.
Perfect. So I think let's shift into a little bit of communication strategies. I know we kind of talked about the trust, but let's talk about what can help move that needle forward. So I know listening and understanding to the patient's needs and goals is really important, but in your opinion, how important is that to change the communication dynamic?
Yeah, I think it's everything. In many ways, I think context is often ignored
Okay.
in those sort of conversations. Um, it's simple to, somewhat simple to look at a radiograph or, what you have sort of
Hmm.
built with your patient examination to kind of come up with a diagnosis and appropriate treatment options.
Yep.
I think the more important aspect is to understand the patient context and your context as well, really,
Yeah.
if you think about it. So, for a patient, in many ways, if you think about how a practice operates, like a simple example could be that a patient travels a lot. In many ways, that might hinder a lot of treatments that we might want to move forward with, including, like for example, orthodontics or Invisalign, for
Yes.
example.
Yep.
Sometimes that requires a lot of follow-ups, but also, more complex treatments like implants and that sort of thing. If the patient context does not allow for them to kind of operate in the way that you function,
Mhm.
those elements should be taken into consideration. So I think understanding the patient context, limitations, their goals in the
Yeah.
treatments is very important. Many patients might come in and tell you, hey, I like take that tooth out. It's the last one.
Yeah.
I don't, I think I have enough other teeth. Like I'm not gonna notice it. You can take that in
Mhm.
and add your explanations and then see how the patient responds to that, and then maybe slowly move the needle towards a treatment that is more in line with your philosophy, right? So
For sure.
explaining that other teeth might over time become fatigued and also uh, suffer a similar kind of outcome when you have sort of in that again example specifically teeth together.
Mm.
You're kind of building strength in the whole sort of group of teeth that you have. So because really the mouth operates as a one unit, and
Yeah.
in many cases patients think about teeth as individual things when in
Yes.
reality the whole the gum and the gingiva and the teeth and the bone all are one unit that need to
Yeah.
be maintained together. So yeah, so those are some of the things that I would say are important in that notion of communication. Yeah.
Excellent. Knowing that, what are some practices that you think dentists can adopt today to help listen more effectively to ensure that communication is delivered?
I think photos are the biggest thing, to be honest with you.
Okay.
I think I remember starting at a practice that had the intraoral camera so accessible, you can literally
Yeah.
just pull it and take a photo.
Yeah.
And that really changed the way I practice because, it is, and often when we're in school, we're kind of taught about decision aids and, showing them on models or drawings perhaps, and some people are really good at that. But I think the simplest way really is snapping a photo and showing it to the patient in the moment. It's funny, like nowadays we're bombarded with images like daily. I actually, funny enough, I was listening to the radio recently and they were saying that a person nowadays get exposed to more images in a day than a person did in a lifetime in the late 1800s, like if you can believe that. So
That's insane.
we're constantly visually stimulated. So
Yes.
I think in that sense, photos can make a huge impact. In reality, you think about the communication that happens in the operatory between the dentist and the patient, and then
Yep.
there's the communication that needs to happen beyond that with the administrative team. Really, people often overlook that. I think that messaging, the consistency in messaging is key, and enabling the staff to have the tools to be able to communicate effectively without requiring to go into details about the treatments or
Mhm.
whatnot. Because oftentimes, you have the patient calling in to ask whoever at the front, why do I need to do this?
Yes.
And uh, having that information accessible for staff, I think, is also key to providing that consistency in messaging throughout the patient journey.
For sure.
Yeah.
I would imagine that even equally speaking in layman's terms would be equally as important as all of those things so that the patient really understands the treatment that they are about to receive.
Indeed, yeah. Because it's quite known. You present a case to patients, and they walk away, and then a week later at the follow-up sort of stage, it's like I didn't realize I need all of
Yeah.
this. In one of the offices that I practiced at, and I still kind of follow this very closely. Um, I I I never really liked having a new patient exam be, say, a part of a hygiene visit
Hmm.
or sort of a secondary thing. It really needs say, a full hour or even a
Yeah.
little bit more nowadays, like with the technologies that the practices have. Like if you're doing an iTero scan, you're trying to jam everything into 1 hour. And if you can imagine having that treatment discussion as well with the patient at
Yes.
that 1 hour, that could be very cognitively demanding of the patient. So in the past, what we've done were we would have that new patient exam or a comprehensive exam appointment, and then I would kind of discuss some of the findings with the patients, but I would tell them that I'm going to actually develop a treatment plan for them, and then that we would bring them back and have an actual treatment conference discussion.
Okay.
And that doesn't have to be as long, and they could have that material ahead of time for them to review as well. And, conceivably you could have a treatment coordinator as well present with you to sort of answer any additional questions that the patient might have in
Okay.
relation to logistics. So these things really, I think that matters because I've been in many offices, as I was associating in the past, where they insisted on having, say, the patient exam in the hygiene chair, literally, or after a hygiene visit. And in reality, what is more impactful is to diagnose the disease and
Yes.
measure what the level of risk this patient has, and then have that conversation. I think that really uh, is is impactful. Yeah.
When you think about the technology that you've worked so hard to create, how or what are some of the features of that technology that help with communication?
At Smilepass, I can speak to that. What we really worked hard on is to kind of develop a digital journey that mirrors what you might see in the practice, connecting the treatment plan to the payment experience. And
Okay.
through that journey, we automate and utilize AI to enhance aspects of this revenue cycle that takes place in the office. You think about insurance verification. That's one thing that we kind of discussed earlier in terms of how patients' decisions are driven by
It's
insurance coverages.
financial,
Having that,
absolutely.
yeah, and having that information readily available for the patient at the time of case presentation is really important.
Okay.
So what we worked on really is to enhance cost transparency with the
Okay.
patient, enhance their treatment literacy by embedding educational content specific to the treatment, um, that also links within the practice website and in a way allowing the patient to visit those websites that are often really not visited by patients. So we typically have that embedded in a digital treatment plan for the patient with descriptors that are easier to understand for the patient. And we also enable the practice to add any number of other decision aids that you might think of or required documentation.
Mhm.
So, and conceivably you could add consent forms, instructions. In the case of, say, an Invisalign, you could add a ClinCheck video to show
Oh,
them what the
wow.
outcome might be like. And having all of that in one live sort of link uh, uh, basically provides all the information that the
Yeah.
patient requires. And then through that, we also integrate the payment option.
Okay.
So in many ways, in some cases, patients have, say, a full coverage or there's a bit of out-of-pocket expense. And for them, having a digital checkout experience, I think, is of value considering
Huge.
how things are nowadays. Like you
Yes.
go to your massage therapist, you don't even have to kind of check out anymore. You can just
No.
walk out and they charge your credit card.
Yeah.
And in many ways, we do those kind of things. We also provide the option of creating payment plans, but also
Oh,
integrating third-party financing into that journey. So in many ways, practices uh, currently offer third-party financing,
okay.
albeit unsuccessfully in many ways when you look at the data. And I think that's because the office has a little bit of legwork to do
Okay.
for those kinds of third-party financing. The patient has a little bit of work
Yeah,
to do. And if you can automate those aspects and build it into that journey, then it's a lot easier and at least more, it's available for the patient. Like they don't
yeah,
have to go that route, but
absolutely.
that's available to the patient. Um, yeah, and maybe lastly, all practices offer payment plans to patients. You think
For sure.
about Invisalign cases are often paid over a long period of time,
Yeah.
12 months, 18 months in some cases. So that's ongoing. But in many ways, those processes are very, very manual. Like I work in a practice where they still um, put a note in the schedule to process a payment for a specific patient for an interim payment for
Mhm.
Invisalign. Um, and they would have like say 10 of those on a certain day. And then you still have to kind of email the patient the invoice. In many ways, you might have to call them to say I'm processing the card as
Right.
well. And some offices are even more archaic. They'll have it on a like a little booklet that
A
they store,
spreadsheet. Yeah.
exactly. Because you technically we're not allowed to store,
Sure.
credit card
Yeah.
information. So we automate that. We really if, with a payment like with the payment plan solutions that we have, we can set up a payment plan once and just forget about it. Like it processes automatically. Invoicing happens to the patient automatically as well.
Okay.
If their credit card is rejected for whatever reason, the office and the patient are notified automatically. And you can think about how time saving this is.
Huge.
Yeah. And, offices want to offer patients payment plans. Like I think
Yes.
in many ways, some offices are concerned about, say, a patient walking away with a treatment without paying. But in reality, if you think about it, if you've established a practice for, say, 10, 15 years and you
Yeah.
have that strong bond with patients, like I don't really think that patients don't want to walk away. They just want the option of
Yes.
paying over time. And I think
Yep.
that in many ways is enabling. Yeah,
I think even for the clinic's perspective too, it's secure, right? Your system is secure, so the
indeed.
patient's information is secure, so they don't have to worry about any of that information being leaked
Yes.
anywhere. So I think that that's also really important.
And we don't save it. So like we integrate with point of
Like a point of
like
sale system.
exactly, and
Yeah.
and they're more capable of storing that information.
Yes.
So we facilitate essentially. Yeah.
I think some of those tools that you offer are pretty unique. I know from a marketing perspective, one of the struggles we typically have is from forms, looking to ensure that, we have the right forms integrated because you're collecting some highly sensitive information when you're asking the
Mhm.
patient for that. And so we just want to make sure that those forms are also secure. They're also HIPAA compliant with all the regulations. And so I know that your software and your system is set up to be able to do that. And then integrating with a website will definitely be it will help ease things for the patient as well as help the dentist in their advertising when they're looking to integrate and make a seamless experience for their patient.
Indeed. So, integrating with not just the patient management software, but also the website,
The
like that's
website.
that's that's interesting. So,
Yes.
Can you share a story of a communication shift in a practice that led to higher acceptance rates?
I would say maybe that bit that I spoke about just at the very end there, payment plans.
Hmm.
We worked with a practice that in the Dental Corp network, actually. So
Okay.
we have a strategic partnership with Dental Corp. We really focused on the more complex cases. So Invisalign cases, implants, the more costly cases, and really offered reasonable payment plans for
Okay.
patients through that case presentation with Smilepass. And we saw a really significant increase in case acceptance.
Okay.
Um, uh, and patient adoption of those treatments. So
What
just
percentage would you say it was increased?
it was about 25%,
That's incredible.
which and this is even, this is at the time of implementation of the Canadian Dental Care Plan. So we normalized for the increases that the network saw across the board in
Hmm.
terms of the Canadian Dental Care Plan.
Hmm.
And that practice was doing a lot better than the other practices in the network.
Okay.
It was really having the information ready for the patient. So the insurance
Yeah.
coverages at the time of presentation and offering those payment options
Okay.
when required, where we saw a significant boost in revenue really for that practice. Really, that is what allowed us to expand our early pilot with Dental Corp into
Okay.
about 20 practices now within their network. So, and we're continuing to collect data now through that expanded pilot. So, yeah,
That's incredible. Like
yeah,
20% improvement is huge for a clinic in terms of like profitability.
indeed, and especially when it's those bigger cases, and you think about it, the labor cost is not increased significantly. So
Hmm.
we saw significant boost in EBITDA as well in relation to that pilot because it's really the dentist production
Hmm.
that is going up. Um, and we're interested in exploring aspects of hygiene as well, really, because I think really hygiene is the foundation for any dental practice and
I
ensuring
agree.
that it's running efficiently as well. And in many ways, patients also reject hygiene recommendations. So in many ways, you might tell a patient you require 4 visits a year, maybe even more, like I would go more, but they might be, again, insurance driven and end up just doing one a year. And that's really impacting their oral health outcomes too. So that's one example that I can share.
Wonderful. So, what would you say some of the benefits of your software are? Is there anything that you haven't touched on yet that you would want to share with us today?
Yeah, I have a friend um, who's in sales, and he always tells me features tell, benefits sell.
Absolutely.
Really, the time saving. I think that's
Okay.
the key thing is we're trying to save practices time spent on mundane administrative tasks,
Hmm.
and it's really hard to measure as well, because if you think about it, the way a practice operates, you have admin that are working on specific tasks. You might be lucky to have a treatment coordinator solely dedicated to
Yes.
managing the treatment
Some clinics do.
plans.
Yeah.
But in reality, those practices are kind of in and out of those tasks. So they're dealing with the patient, greeting them coming in, scheduling them, checking them out, and doing all those other things.
Hmm.
So managing outstanding payments or calling patients about outstanding treatments.
Hmm.
And what we created is really a digital structure for them to follow um, seamlessly, with a lot of the information automatically um, pulled into the system, and
Okay.
that's really a huge time saving.
Okay.
If you think about talk to any dental office, one of the biggest pain points for admin is really dealing with insurance coverage
Yes.
and how long it takes for them to verify, sometimes call the
Hmm.
insurance to obtain that information. If you can make that simpler and more available, I think that has an enormous impact on how the practice runs really. And in many
Absolutely.
ways, that consistent messaging that I talked about is really embedded into this, because what we're at Smilepass, like I often say this, we're not operating at the stage where the dentist is interacting with the patient, I would say.
Hmm.
In reality, we're operating under the assumption that the dentist is competent and capable of developing an adequate treatment plan, and we pull that treatment plan into our system and enable the admin to manage those treatment plans and
Okay.
payments. So that's really the benefit of, or what we think the benefit of small passes.
Smilepasses.
Yeah.
That's incredible. What would you say the best habit today a dentist can start asking to improve communication?
I mean, we talked about it earlier, listening. I think, simple as it sounds,
Simple. Okay.
in many ways, nowadays we're already formulating sentences in our head as we're listening to people. And I think we just gotta really pause that if we can, and
Hmm.
just listen to the patient and try to
Hmm.
take it in. Um, that's really how you build trust. And the other thing is really don't be afraid to allocate more time to that initial patient visit or that comprehensive exam,
Hmm.
and really try to get to know the patient, and maybe even set up that second treatment conference appointment, because even if you want to do it virtually, because nowadays
Hmm.
it's so um, readily available,
Hmm.
even to patients. Like patients nowadays say, "Oh, can we do this over the phone?" So I think those are the two things that I might offer as a
Okay.
clinician.
That's perfect.
Yeah.
And then, if you were thinking from your perspective, we know communication is one strategy. How quickly do you find the administrative team can adopt the technology that you guys have created into the clinic?
I think that's really always the biggest hurdle is you go into a practice and you're offering something new, and they're like, ugh,
Yes.
my staff won't like this one bit. From my standpoint, and working even with other software companies, and even as I set up my practice, looking at payroll software, those things,
Hmm.
the ones that really stand out are the ones that have really close relationship with that customer.
Hmm.
So what we focus on is really heavy onboarding in the beginning,
Okay.
and really uh, holding the practice's hand, really
Okay.
understanding their pain points. We do a sort of a setup period where we
Okay.
understand, what your outstanding treatments are like, what the AR is like, how the practice operates. So we try to learn all of those things in the beginning, as we're engaging a practice,
Okay.
and try to tailor our onboarding in a way that is compatible with
Okay.
their needs and their limitations. Yeah.
That's incredible. Thank you, Dr. Alba, for being with us today. It was a pleasure having you as a guest, and we look forward to speaking with you in the future.
Likewise, thank you so much for an engaging conversation.
Thank you for tuning in to Behind the Smile. If you want to see more episodes, please subscribe to our YouTube channel, and we'll see you next time.